Others say there's no such thing.
We were being ignored by doctors.
Doctors like calling you crazy.
The News 4 I-Team exposes the Lyme Wars, a battle in the medical community, leaving patients paying the price. A special multi-part I-Team investigation starts Monday at 5:30.
A disease that touches thousands here in our area, but there are some bitter fights over who has it and how to treat it.
And yesterday we explored the battle over chronic Lyme. Tonight, how both sides are digging in and the government's response. As News 4's Natalie Pasquarella reports, this part of the Lyme Wars is one of heartbreak and hope.
I didn't want to get out of bed anymore. It all became very pointless, like an endless cycle that I couldn't escape.
6 months ago, Kyra Lerner never imagined, couldn't fathom that she would be sitting here.
I really just wanted to lock myself in my room forever and disappear.
When you decided I want to go public with this, what is this about, talking about this?
It's really about helping everyone and making the awareness of the disease itself more known. It's a really terrifying thing, and I know that now.
An upbeat teen with a love of sailing and photography and the daughter of WNBC president and general manager Eric Lerner, Kyra didn't know what to think when the first signs of trouble flickered.
There was kind of a low-key anxiety that followed me around everywhere I went. And then other symptoms started coming on. For a while, I had no idea, didn't know what was going on with me.
Her doctors and parents didn't either.
I went to doctors for a depression problem, and I got antidepressants and anxiety medication, but nothing really happened. There was other doctors I went to see to try and figure out what the headaches were, what the fever-like symptoms were.
As harrowing handwritten notes by Kyra's mother reveal, her symptoms would soon get far worse. That's because her doctor now says she was suffering from an insidious, undiagnosed case of chronic Lyme disease.
You see so many different presentations of Lyme disease, but really when it comes down to it, you have the patient who is a case history of one.
This one was so unusual, Dr. Stephen Bock alerted a state Senate committee investigating Lyme and tick-borne illnesses.
I had a 15-year-old young lady brought to me by her parents. She was an A student, and she had depression, severe depression, on 4 medicines.
Bock says Kyra is also a case study in the Lyme Wars. Despite 30 years of treating Lyme in the Hudson River Valley, many doctors don't buy his diagnosis.
It's just amazing how there's this dichotomy of one field that says there's no such thing as chronic Lyme, and the other who says that Lyme is the great imitator.
Bock is secretary of the International Lyme and Associated Diseases Society, or ILADS. Its 650 doctors believe bacteria from infected tick bites can hide in the body, and FDA-approved blood tests are often unreliable.
That is incorrect.
On the other side, doctors like Sunil Sood, who belong to the Infectious Diseases Society of America, or IDSA. It's more than 11,000 doctors believe Lyme is fairly easy to diagnose and can usually be treated in a month. The IDSA guidelines carry extra weight because they're followed by the CDC. Connecticut Senator Richard Blumenthal believes the debate is paralyzing government's response to a public health crisis.
The biggest frustration for me is the lack of adequate diagnosis.
As State Attorney General, Blumenthal fought the IDSA over its treatment guidelines. While he lost that war, he believes a new federal task force created at the behest of Connecticut and New York senators is an important step.
This task force will have experts, doctors, researchers, government officials, but also patients.
The task force will also address funding. There's little debate Lyme gets a pittance in federal research dollars compared to other infectious diseases.
It really needs and deserves the kind of financial investment from the government that will develop better diagnosis and more effective treatment.
Dr. Bock says the dollars that do flow tend to go one way.
I think a lot of the money goes to IDSA physicians who are doing the same research and supporting kind of the same conclusions.
Any conclusion, any answer. That's what Kyra was desperate for earlier this year. Forced to leave school, hiding most of the day in her room, her body ached and her mind spiraled even further.
There was one day that I walked into the store with my dad, and I go, "Is it raining in here?" It felt like there was water, like, sprinkling on my hands.
In the grocery store?
In the grocery store.
Finally, this spring, after months of seeing other doctors, Kyra found Dr. Bock. His blood tests found she had 2 tick-borne diseases.
I made clinically a diagnosis, that this is Lyme, and then started treating her with oral medicines, which she responded to about 50%.
There were small little things that began to happen. Like, I think some of my mind began to clear up.
Kyra also got antibiotics through what's called a PICC line, a constant drip in her arm. It was the boost she needed.
My bones, my joints, things started to stop hurting as much. The fatigue began to lift. I had more of a desire to do things, and kind of my old personality started coming back to me.
While still taking pills and supplements to restore her body, Kyra says she's been forever changed by Lyme.
I think it's good to have examples out there like me to show what can be done and what should be done, because I made such progress, so it's possible that other people can too.
Another sign of progress, the fact Kyra is sitting here in a marina on the Long Island Sound where she's finally planning to sail again.
Do you recognize the person you were at one of your lowest points?
It's a completely different person to me. My mind is clear, I'm more happy, I can feel happy again, and I see a future for myself again.
Natalie Pasquarella, News 4 New York.
And we want to share more good news. 2 weeks after Kyra talked with Natalie, she went back to see Dr. Bock, had her PICC line for antibiotics removed, and she's also back in school part-time. She's hoping to ramp up to a full schedule in the next 2 weeks. You know, Stacey, I think we all heard of Lyme disease, but this tug of war in the medical community and the impact on families, I, for one, I didn't really know.
Well, and kudos to her parents. Any parent would do it, staying on the doctors until they figured it out, and she's going to be a lifelong advocate for other people out there.
Turn to an I-Team investigation that could help you or someone you